first question I just really wanted to ask you was if you could, state your name and your position.
Okay, so my name is Kaedrea Jackson. I have, I would say, like three positions right now. First, I'm the deputy CMO for Mount Sinai Morningside Hospital. I'm also the medical director of the ED, so I manage the ED and the daily day operations for that hospital. And I'm also the vice chair of quality, safety, and patient experience for the Mount Sinai Health System, all our emergency departments, which are six emergency departments across the system.
Got it. Okay. Yeah, that's definitely a lot. So can you kind of tell me more about your role as a medical director at Mount Sinai, St. Luke's, and how this position, aligns with your career goals?
So, my passion has always been to become a physician, but I realized as I went along in residency that I really did have a desire to do more mass or global improvement. Okay, so more than that one-on-one patient interaction, which I do love. I do still cherish my clinical shifts, but I also wanted to make sure that we're having an impact on as many patients as possible. So in my day-to-day operations, in particular for the ED, I handle everything that manage the ED in terms of whatever needs to get done to make sure an emergency department run. Um, Looking at quality and safety operations, throughput, turnaround time, staffing wise, that's me. For the hospital, I handle throughput and just a more focus on physician communication and everything around physician interactions with physicians, nurses, and patients themselves.
Got it. And I was just curious to know too, how you were impacted as you're the medical director of the hospital and everything. How are you impacted by COVID-19? How was that for you, especially during 2020?
Exhausting, extremely exhausting. I remember going, and when I look back at it, it's like it was just like residency all over again because you're in the hospital long hours every day, and it was just a welcome back to residency. So it wasn't, but it was tiring in the sense that um, you had to put in long hours, but it was kind of scary because it was new, right? And it was new to everyone. And there were people who were scared, not just this is not before we're used to treating patients comforting, and now staff themselves were scared. So it was definitely new in that regards, but we managed through it, we got through it, and thankfully we were able to get through without losing anyone of our members on our team.
That's great to hear. And so as you graduated from Stony Brook, how did Stony Brook University align? Not align, but how did Stony Brook University aid you in your career?
Definitely gave me a foundation. I think about being at Stony Brook and having my first time volunteering in an emergency department, which is what actually skyrocketed all of this, was at Stony Brook. And just being there in the ED there and just saying, like, this is what I want to do. So when I started medical school, it was very easy in the sense that I knew exactly what specialty I wanted to go in just from that experience, but it was great. It was just all the time spent in that hospital. It's like, I know what I want to do. And they definitely gave me the solid foundation that I needed to ensure that I got where I wanted.
That's great to hear too. Um, so how did it feel when you were elected to the list of New York Metro Super Doctors Rising Stars for 3 years in a row, not just once?
It felt great, especially since my boss was competing with me. It's not that he's competed, but he definitely did point out, it's like, I've been on this list. So every time that I've got on it, it made me feel proud because I knew it wasn't an easy thing. Not a lot of emergency medicine physicians are on that list. It's usually because it's very hard in a sense that we don't typically have continued patient interactions. Our patients are whoever we see in the ED. So with an internist or a specialist, you're going to see the same patients over and over. So building that rapport to actually be elected is much harder from an emergency medicine standpoint. So it definitely was something I was proud
Congrats, by the way.
Thank you.
Um, and then being a woman, being Black, how did you feel that you were defying the odds when you were notified of this?
You know, I try, I going through school, trying my, like just working, I never felt like I was defying odds. But as people used to point out to me, and they're like, you're a unicorn, because that's what we actually call um, Black female physicians, unicorns. And because we're so rare, and we're 3% of physicians are Black females, and we're actually have increased and unfortunately surpassing our male counterparts, our Black men. But it was, I felt good just reaching where I needed to be or reaching where I wanted to. And people did point out, this is big for being a Black female, and I get that, but that's not. I don't know. I didn't. It's hard. I tried everywhere I went and every position I've gotten. I know I got there from the hard work that I did, and that's what I focused on. And I never focused as much as race because I never wanted it to be that someone felt that I achieved what I did because of my race, or I was like, oh, they wanted a little color here. I knew I worked hard, and that's what I focused on.
Yeah, of course. Yeah, that definitely makes sense. You know that you got it because you earned it, not just because it was
Yes,
given to you to, check a box. So
exactly.
got it. In terms of other awards, you are also one of the 6 residents nationwide to receive the American Medical Association AMA Excellence in Medicine Leadership Award. So, what did this award mean to you?
Well, it was definitely recognition of the hard work I did in residency. My passion to get involved in advocacy and leadership started then. And it was great that knowing, first being nominated when my organization at that time, Emergency Medicine Residents Association, said they wanted to nominate me. I was like, really? And they're like, yes, because you do a lot. So you get nominated for things. I was like, oh, go ahead, nominate me. I was shocked that I got elected to it because, the work that it's not that I'm doing the work that I was doing at that time, I didn't do it for recognition. I did it because it needed to be done. I did it because it was a value to me. So when someone else is definitely saying, wow, and being amazed, you're like, really? This is my day to day. This is what I'm trying to do. So, um, it was a proud moment. I'm not gonna lie. I was very excited that they did recognize me, but it was really just knowing that someone else is recognizing your passion and seeing that you're doing good. So it was great.
Got it. And I know you mentioned the lack of Black female physicians and male physicians as well. What are your thoughts regarding that matter? What more can, whether it's society or the healthcare system, do to increase those numbers?
No, it's unfortunate. I think Black Americans they have at times they have access to less wealth, housing, education, and just to be honest, mentorship. Um, I I remember I when I moved to this country initially, my mother was not aware of. She always stressed education is important. So of course I was going to try my hardest, but I really do feel that mentorship is key in regards to when someone identifies that you have a gift or you're someone that we should invest in, that they give you that not that they just connect you, but they give you guidance, and that's what happened to me. And I, I love my mother. She did everything, and my parents they did everything. But having that outside person, especially since they weren't from this country, saying, "Why don't you apply to this program? Apply to that program." That's what actually helped me. I'm a public school graduated person. I've done everything from public school, and it's possible to get where you want to in the public school system. It's just that I do think you need mentorship. I think that's what I try and do. I've had many mentees, and I still have many mentors for myself. I try to sponsor people, pull them up, and I've been sponsored myself. So it's a continuing chain that what was done for me, I try to do to others, and I think it's key because we have to identify those that are gifted because it's not lack of ability or lack of passion. It just might be just lack of awareness, and we have to connect them.
Got it. And on that same note of mentorship and teaching, you also began teaching as an associate professor of emergency medicine. What
Yes.
made you decide to want to start teaching? Do you love it?
I actually do. And I actually gave a lecture earlier today on risk management. And it's more of, I love giving guidance. I love helping bringing someone from a place of less knowledge to more. And it's more of, it's like, I remember those, everyone is a different learner and there are different teachers. And I just remember being that person that sometimes I was very intimidated. So I loved it when I'm teaching, I try and completely be everything opposite of intimidation. And I want people to be comfortable. I want them to be able to just, I say, what, it don't, no answer is stupid. Just tell me what you feel. And it makes me feel great when I'm helping someone actually fully understand something. Um, I mean, I see you because they do critique you, and I see you in my reviews, and they're like, "Thank you." I break it down. I just want people to learn, and it's great, and that's my focus. Not to put someone down, because there's some teachers. I'm just like, why did you go into this profession? But it's really just I do like making sure that people are comfortable and they understand the topic or whatever we're talking about, because that's what's going to get us where we need to be. It's like I get no passion out of not out of having individuals not do well on a test. So my goal is to try and have you do the best that you can do, because I think people have the potential. You just have to try different things in terms of their learning.
For sure. I definitely agree with that. Let's see. So, as the theme is breaking the bias for Women's History Month, how do you feel that you are breaking the bias in the healthcare system, in the physician world?
There is this bias that especially women of color are typically, once they reach a certain position, that one, they're either mean, angry, not friendly, things like that. I think, and all my interactions, especially with every time I see a black female, and I tell people all the time, it's like, I'm gonna run over and just say hello, because there's no point for this. I've made it here, and now give me the recognition that I deserve. It's like, no, I'm happy that I'm here. I'm happy to see others get there, and I want to help them. I think also in terms of when I'm in meetings, boardrooms, wherever with other individuals, I've had someone say that I'm being very aggressive or angry, and I'm like, no, I'm actually giving you exactly the same attitude, the same response that you're given, and it makes people stop back and think, because they realize, oh yeah, she is. So I enjoy doing that to the passion, because it's unfortunate that once that there is this belief, or when a woman has made it this far, how she is, and just recognize the value that she has and that she brings to the table, and that's what matters.
Yeah, well said. Um, and I know you kind of mentioned slightly that someone, told you something. So in terms of, discrimination, have you ever experienced discrimination when it comes to gender in the workplace? And if so, how did you overcome it, if you're comfortable sharing?
I have, and it's always, and I alluded to it already in regards to not just it was gender and race put together, and it's confronting it, definitely. It was a time where it made me very upset, and at some points somewhat emotional, not emotional in the sense that I can't handle it, but it did. It's like, are we really doing this? This is We are so far from this, and especially in healthcare, what it did, it made me, the fact that we're all there caring for patients, but we are clearly, it's still the old school belief, and it's old school practices in terms of white males are superior. So how I approach it is I do address it. And one particular instance, I did address it. I asked to meet with the person, and I wanted to talk to them, and I explained to them why their actions were biased. I'm not sure. It was a good meeting in the sense that we were able to leave and on working terms are amicable. Do I think they really learned something? I don't really care in the sense that I wanted to make sure that they understood why what they did was wrong. And I definitely made sure that I was going to explain that appropriately. And definitely they received it. I actually have we have a little work group of Black leaders, Black female leaders across our system, and we discuss things that are unfortunately still happening, and it still does. But we have a support system. We give each other ideas, and we're it's definitely biases are not going to go away anytime soon because it's unfortunately ingrained. I'm sure it's ingrained in multiple industries, and it's unfortunately still there in healthcare.
Got it. And my last question for you is, how do you fight against, like you were mentioning, discrimination and fight for social justice in your role specifically?
Definitely being present. I know that my appearance, being Black, being female, it adds value. It lets people recognize that this person is like, I look like so many others who may not be who are similar to me, but may not be in the position as me. I'm also an immigrant. I'm not originally from this country. So do I speak on it? Yes, I go to schools. I go to community events. I talk to patients. I love talking to patients. You know how great it feels when you have the patient who you're caring for, they're like, I just love seeing you, who you are. Because when there's someone asks, oh, can I speak to the director or can I speak to whoever's in charge? And I come, and you're like, you're the one who's in charge? I'm like, yes, I am. Yes, I am. And especially with, I have to say, our older women, like someone that looks exactly like my grandma, when they are happy to see me, I want to just give more to them because it's like my position is like sometimes they see it as their dreams coming true, that there is something else. There is definitely looking what you've become. So I'm present and I'm trying to be as present in as much places that people who need to see me can see me.
I think that was perfectly said. And yeah, is there anything else that you would like to include that I didn't mention?
You know, I miss Stony Brook.
Aw,
Definitely life changing, wonderful experience that my 4 years there. But I applaud this the initiative and the event that you guys are sponsoring because I think these are the programs. I remember going through things like this and then seeing someone's like, I want to be that person. And I'm just hoping that as we do more of these, it becomes norm. Like it becomes the normal, like people say, oh, you've done so much. It's like, no, I want it to be the normal. It's like, oh, that's another Black woman in
yeah.
that position. I want that to be a norm. And I think what you're doing right now in terms of having just promoting these Black leaders, Black female leaders, that we're getting to that.
Yeah, for sure. I agree, like what you were saying before. Like if you don't see it, you don't think you can achieve it. So it's really helpful to see that representation.
Definitely.